Dysmenorrhea. What is dysmenorrhea? It's a medical term for pain with menstruation. There are two types of dysmenorrhea, primary and secondary. More than 50% of post-pubertal and menstruating women are affected by dysmenorrhea, and 10 to 12% of them having severe dysmenorrhea with incapacitation for 1 to 3 days each month. Primary dysmenorrhea, this is the first type, is common menstrual cramps that are recurrent, come back and are not due to other diseases. Pain of course begins 1 or 2 days before or when menstrual bleeding starts and is felt in the lower abdomen, back or thigh. Pain can range from mild to severe, can typically last 12 to 72 hours and can be accompanied by nausea, vomiting, fatigue and even diarrhea, and the symptoms may vary from person to person. And common menstrual cramps usually become less painful as a woman ages and may stop entirely if the woman has a baby. Coming to the secondary dysmenorrhea is pain that is caused by a disorder in the woman's reproductive organs such as endometriosis, and endometriosis is displacement of uterus, and adenomyosis, any myomas, uterine fibroid in the uterus, or even any infection. And pain from secondary dysmenorrhea usually begins earlier in the menstrual cycle and lasts longer than common menstrual cramps. Pain is not typically accompanied by nausea, vomiting, fatigue or diarrhea. What causes dysmenorrhea? Contractions in the uterus, which is a muscular contraction by a chemical called prostaglandin. Menstrual pain from secondary dysmenorrhea is caused by a disease in the woman's reproductive organs. Endometriosis. Endometriosis is the tissue lining in the uterus is found outside of the uterus, anywhere. It may be in the abdomen or anywhere outside of the uterus. Adenomyosis is a condition where the lining of the uterus grows in the muscles of the uterus. And pelvic inflammatory disease, that is the infection caused by bacteria that starts in the uterus and can spread to other reproductive organs. And cervical stenosis, narrowing of the opening of to the uterus. And fibroids, it's a benign tumor, growth on the inner wall of the uterus. Coming to the pathophysiology of dysmenorrhea. The prostaglandin, the endoperoxides and the metabolites, here the prostaglandin, this regression, the corpus luteum regression is causing the production of prostaglandin. So what it's doing, it's increasing the blood flow, and this prostaglandin, endoperoxides and metabolites, this all stimulating the blood flow, and there will be increased myometrical contractions. Myometrical contractions, so here only there will be occurrence of dysarthria, and as a result there will be reduced blood flow to the lower extremities. So what will happen, the person will be having sometimes cramps in the lower extremity, and in coming to the uterus there will be increased uterine activity and even uterine ischemia, sensitization of nerve terminals to prostaglandin and endoperoxides. Here the condition that the person will be feeling the pain in the lower abdomen. What are the symptoms of dysmenorrhea? Aching pain in the abdomen. Pain may be severe at some time. Feeling of pressure in the abdomen. Pain in the hip, lower back and inner thighs. Diagnosis and test. So the pelvic examination mainly. Here we will be assessing the uterus, cervix, opening from the vagina to the uterus, fallopian tubes, ovaries, bladder, rectum. How the exam performed? Ask the patient to take off the clothes in a private, and the patient will be asked to wear a gown and talk the patient about the health concern we have to take concern. Ask her to lie on her back and relax. Press down on areas of lower stomach to feel the organs from the outside, and help get in position for the speculum exam. And this is the time we will ask the patient to slide down to the end of the table. Asked to bend the knees and to place the feet in holders called stirrups, and here we will be perform the speculum exam. During the exam, the speculum will be inserted into the vagina, that is the vaginal speculum. You have seen that vaginal speculum will be inserted into the vagina, and it will be open to widen the vagina so that the vagina and cervix can be seen clearly. And perform a pap smear. So we can collect a pap smear in a glass slide. Doctor will be use a plastic, that is spatula, and a small brush to take a sample of cells from the cervix. A sample of fluid may also be taken from the vagina to test for infection. And after, finally, we will remove the speculum. Then perform a manual exam. Doctor will place 1 or 2 fingers inside the vagina and uses the other hand to gently press down on the area he or she is feeling. Sometimes a rectal exam is performed. Doctor inserts a gloved finger into the rectum to detect any tumors or other abnormalities. Finally, doctor will ask about the exam. Patient may be asked to return to get test results. If secondary dysmenorrhea is suspected, further tests may be needed. First aid advice for dysmenorrhea. First one is rest. Assume a comfortable position that is based on the patient will and wish. Whichever the position appropriate for them, we can advise. Apply warm compress with a heating pad. Glass bottle with hot water wrapped in a cloth can be applied for 15 minutes every 4 times a day. Gentle massage of the lower abdomen or lower back with a coconut oil may help. Here the coconut oil on your hand, rub them together for 5 to 10 seconds. Wrap them around the lower abdomen or lower back for 5 to 10 seconds and then gently massage. May apply liniment like wintergreen and that containing methyl salicylate with menthol or camphor. Do not apply if there is break in the skin barrier like abrasion, graze, cut or laceration. Analgesics and anti-inflammatory over-the-counter drug of choice like aspirin, ibuprofen, mefenamic acid and naproxen may be taken after meals or snacks to relieve pain. And even paracetamol may also be tried for mild pain. And the following are no longer first aid measures but are recommended because they can help in relieving dysmenorrhea and prevent attacks. Have adequate sleep. Have regular exercise, walking, yoga, 30 to 60 minutes at least 4 hours a week. And some women find that orgasmic sexual activity may bring relief. Avoids food that contain caffeine and salt, and avoid smoking and drinking alcohol. Coming to the algorithm for the management of primary dysmenorrhea. So primary dysmenorrhea, so if it's positive, steroid contraceptive, negative, steroid contraceptive, and we will be giving oral contraceptive. If it's positive response, we can maintain like that. If it's negative response, we can add non-steroid anti-inflammatory drug. So if non-steroid anti-inflammatory drug patient is responding, we can maintain that. And if again negative response, plan for laparoscopy to rule out pelvic pathology. And here the pathology negative, we can give calcium antagonist and psychiatric therapy. And if you are getting a pathology result positive, based on the result, we have to start the appropriate therapy. And coming to the steroid contraceptive negative, if it's negative, gastric ulcer, positive, gastric ulcer. So positive gastric ulcer, again we have to plan for oral contraceptive. And negative gastric ulcer, start prostaglandin, that is non-steroid anti-inflammatory drug. The positive response, we can maintain that. And here again negative response, plan for laparoscopy to rule out pelvic pathology. And here it's to pathology result, we can start appropriate therapy. And negative pathology result, again start calcium antagonist and psychiatric therapy. Coming to the treatment, primary dysmenorrhea is usually treated by medications such as analgesic medication. Many women find relief from non-steroid anti-inflammatory drugs such as ibuprofen and naproxen. And oral contraceptives also may help reduce the severity of symptoms. Nausea, vomiting may be relieved with anti-nausea, antiemetic medication, and sometimes without taking treatment also these other symptoms may disappear, and even cramps also subside. And implantable contraception and progesterone intrauterine devices which release low levels of hormone progesterone have also been found to be very helpful in decreasing pain. Treatment for secondary dysmenorrhea will vary with the underlying cause. Diagnostic laparoscopy. Other hormonal treatments are trial of transcutaneous electrical nerve stimulation or potential NESTEP. And if the person is having a fibroid, better we can plan for surgery. Coming to the non-pharmacological management for dysmenorrhea. Holding a heat pad or hot water bottle on the abdomen or lower back, taking a warm bath, doing mild exercises like stretching, walking or biking. Exercise may improve blood flow and reduce pelvic pain, and getting plenty of rest and avoiding stressful situations as the period approaches. And you can even start doing yoga. Thank you.